One of the really interesting parts of Psychology 202, Abnormal Psychology, is that we're going to do a lot of case studies. And so what I'm going to do is I'm going to walk you through the first case study, and I'm going to show you how you write up a case study and how you look at a psychological analysis of a case study. So the first one that we're going to have, you will be given the case study. It'll just be something short for you to read. Usually they're not very long. This one is called Judy, the Girl Who Fainted at the Sight of Blood. And you have this, but I'm going to walk you through it as if you're actually doing this case study. So we're going to go through, we're going to read it real quick, and then I'll show you the reactions that we have and how we look for them. But it's really interesting because in psychology, since psychology is a result of somebody's behavior as well as mentally what they think, then we look for something called triggers. So we're wanting to know what's triggering the behavior, so we've got to know a little bit of the past. So here we go. Let's talk about, this is classic Judy and the Girl Who Fainted at the Sight of Blood. So you have this in your deal. You may have already read it, but let's walk through this. So Judy, a 16-year-old, was referred to our anxiety disorder clinic after increasing episodes of fainting. About 2 years earlier, in her first biology class, let's blame the biology teacher here, okay? In their first biology class, the teacher showed a movie of a frog dissection to illustrate various points about anatomy. This was a particularly graphic film with vivid images of blood, tissue, and muscle. About halfway through, Judy felt a bit lighthearted and left the room. But the images did not leave her. She continued to be bothered by them and occasionally felt slightly wheezy. She began to avoid situations where she might see blood or injury. She stopped looking at magazines that might have gory pictures. She found it difficult to look at raw meat or even Band-Aids because they brought the feared images to mind. Eventually, anything her friends or parents said that evoked an image of blood or injury caused Judy to feel lightheaded. It got so bad that if one of her friends exclaimed, "Cut it out," she felt faint. And you can see how this trigger has just gotten crazy. So we're going to talk about that. Once again, in psychology, I still think if you use the word crazy, it should cost you $1. But I'm the one that would probably owe a lot more money than I care to put out. So even if her friend said, "Cut it out," she felt faint. Beginning about 6 months after her visit to the clinic, Judy actually fainted when she was unavoidably encountered something bloody. Her family physician could find nothing wrong with her, nor could several other physicians. By the time she was referred to our clinic, she was fainting 5 to 10 times a week, often in class. Clearly, this was problematic for her and disruptive in school. Each time she fainted, the other students flocked around her trying to help, and class was interrupted. Because no one could find anything wrong with her, the principal finally concluded that she was being manipulative and suspended her from school, even though she was an honor student. Judy was suffering from what we now call blood injury injection phobia. A phobia is a fear of anything that has a trigger that causes you to react a certain way. Her reaction was quite severe, thereby meeting the criteria for a phobia. A psychological disorder characterized by marked and persistent fear of an object or situation. But many people have similar reactions that are not as severe when they receive an injection or see someone who is injured. Whether blood is visible or not, for people who react as severely as Judy, this phobia can be very disabling. They may avoid certain careers such as medicine or nursing, and if they are so afraid of needles and injections, they would avoid them when necessary and put their health at risk. So that's the story. That's the story of Judy. Let's walk through this. I mean, as much as we could just stop and discuss it. The first thing we're going to do is you're going to describe basically what the situation is. So Judy was a high school student. She saw a film in biology that showed a frog being dissected, and it was particularly graphic, meaning that we probably cut the skin, we peeled that back, we cut, I don't know if you dissected a frog or not, but we peeled it back. I know as a science teacher, I know I'm always talking about how it's rubbery and everything. So there was not a lot of true blood in this because this is a preserved specimen. But on the same token, she just kind of was overwhelmed by this dissection. So what happened was, as she in her mind, she began to associate the dissection with blood. So as I described this high school student basically saw a film. Okay, and we don't know if she actually dissected this frog or not, but she saw a film on the dissection, and it triggered her that every time something had to do with blood, that she saw these. It brought back these images that were terrifying for her and caused a problem. So that's basically the description. High school student saw this film. The trigger was this, that every time she saw blood, she thought of this deal. Now, now it's interesting because all of the case studies that we're studying here have all gone to a particular clinic. And these persons have, all of the different people we have in abnormal psychology are actual case studies of people that we have studied for years that have actually been to a clinic and actually dealt with severe phobias or abnormalities or whatever it is we're studying. So basically that's her description, and we can even put down that it got so bad that even if a friend says cut it out, she would become faint. Well, here we go. Years later, she's fainting 5 to 10 times a week. Her principal says this is so much of a disruption that he suspends her from school, and now she's no longer in school, and here she is. So that's a description. So the first thing we're going to do, okay, you might make some notes here, is you're going to just basically describe what happened in the case study. Now, I don't want you to rewrite it. I want you to do kind of like we did. I just want you to describe it. And then I want you to tell what the trigger is, okay? I want you to tell me what the trigger is. The trigger on this one, okay, the trigger on this one is not a frog. Let's don't, it's not the frog dissection that's the trigger. Blood is the trigger, okay? So, did you see that? It's not whenever she sees a frog or whenever she sees a frog being dissected. No, it's anything that has to do with blood. Which is kind of interesting because the association in her mind, as we learn abnormal psychology, we're going to see that everything has to do somehow with associations. Okay, so here we go. So she triggered that frog being cut with that scalpel with bleeding, even though there actually probably was no blood in the dissection. So, but blood is now the trigger. So anytime she sees anything associated with blood, she sees these reactions it comes back to these gory pictures of the frog, and I would imagine that it's getting worse and worse in her mind. I would imagine that the original muscle cutting of that is now just lacerated, and I would assume that the organs, we pull out the lungs and different things, I would assume that it's even gotten bigger than life. So the trigger now is blood. What's the reaction now? Okay, so what's the reaction to blood? The reaction to blood, okay, is now that we are lightheaded and that we often faint. As a matter of fact, now we're fainting 5 to 10 times a week. So anything associated with blood, remotely, a Band-Aid that might have blood on it, it's kind of, once again, remember the trigger's blood, it's not the frog, but it takes you back to these gory deals. So what we have now, the reaction is lightheaded and we faint. Now, here's the other part of this twist, and as we get into this class, it's going to be really interesting because what you're going to see here is that as she feels lightheaded and she begins to feel faint, we have to think, why can't we turn the trigger off? Okay, why can't we turn that trigger off? Why can't we just be like, why can't we just say, okay, well, that blood is not a frog. Okay, so this is so the next part. Okay, so we tell what the trigger is, we tell what the reaction is. All right, then we give suggestions on how we might. Now, once again, we're not a psychiatrist. We're not a medical doctor of psychology. We don't even pretend to be. We just look, because a normal person can redirect that trigger. So, you say to yourself, if it was me, how would I redirect that? How would I redirect that trigger? And so, so number one, you describe what happened in the article, you tell the trigger, and then you tell the reaction, and then you tell how might we redirect that trigger. So, for me, I might be like, I don't know if I see something that has to do with blood. Now this is kind of an iffy deal, so I'm not gonna, there's lots of ways to do this and different things. First of all, if you put how might we redirect the trigger, if you put that we're going to avoid blood, then that's not a good redirection because you're going to run into blood. The thing about abnormal psychology is we're going to have those triggers. So you can't put, oh, I would just ignore anything that has blood on it. That's not going to work. So instead, I have to have some way to redirect it. So I don't know. I'll throw out a few, and you'll come up with some of your own. I would probably have to take the blood and associated it with the heart, associated it with living, and I would have to make myself see blood as healthy. Now once again, you've got to think about it yourself. How would we redirect the trigger? Now, I'm being really vague because I don't want you to just take what I say and write it down. I'm being overly vague because I want you to think about it. So we describe, we tell what the trigger is, what the reaction is, how we might redirect the trigger, and then we tell two more things. We tell the future. If they overcome this, then we talk about how it turns out. Well, it turns out okay. If she can overcome that, we're looking at Judy here, if she can overcome this trigger, okay, then she won't become faint. She might still be a little queasy around blood, but it's not going to be a major thing. It may cause her to avoid certain careers or that type of thing like they talked about there. Now, the other thing we got to do is talk about the future. If she's consumed with this trigger, then she won't be able to react at all. She won't be able probably to function in life with any particular job or even having kids, okay, or being married or whatever. Because if she's consumed to this trigger, she can't avoid blood. And once again, I was very vague on those, and the more you write, the better you'll get. But the different parts, number one, describe. Number two, the trigger, tell what the trigger is. Number three, tell what the reaction is. Number four, tell how we might redirect the trigger. Number five is the future. What if we overcome it? And then also, the second part of number five, what if we're consumed by it? So you'll just simply do that for each case study. I think you'll really enjoy the case studies. Judy with the blood, and we refer to them often in the lectures. So good luck with the case studies. I look forward to reading what you come up with.